Hi, I'm Madhu, counseling psychologist and a clinical nutritionist. Hope you're all doing well. Today we're going to talk about SAD. We all know what SAD is, however, it also abbreviates to seasonal affective disorder. So, what happens in SAD? A person is depressed at the same time of the year every year. It's mostly winters, so they are depressed in winters. They have low mood swings. They are not motivated. They are unable to do their daily chores. They're very less productive, socially reclusive. They don't want to get out of their bed every morning. So these are few symptoms of SAD. So it is not self-diagnosed. If you or anyone close to you, your family members or friends, are going through the symptoms, you should reach out to an expert, a psychologist or a psychiatrist, for a clinical diagnosis. Identifying the symptoms is the first step in overcoming depression or SAD. So simple tips I would offer is, if you think you're going through the symptoms, I would suggest keep yourself warm, wear more warm clothes, layer yourself with more warm clothes, and try to stay in a well-lit environment, maybe a bright room with bright lights. That will help. And eat nutritious food. Anyone is depressed or they're having a low mood, they tend to overeat or they try to reach out to wrong foods. Carb overloading happens because carbohydrates, they have a nature to elevate your mood. So this is very common when somebody is depressed or they have a SAD. They gain weight in winters because they reach out to the wrong food that elevates their mood. So there are foods, there are nutritious food that you can choose, which is also nutritious and also elevates your mood. For example, you can snack on nuts, dates, seeds, and these are all nutritious, healthy food that also takes care of your mood, right? Try to minimize your carb overloading. Usually people reach out to chocolates and ice creams and cakes. These are feel good food, as in they will give a spike of sugar and they will give you temporary mood elevation, right? But then it will also give you unnecessary weight gain. So try to reach out to good food, right? You have your healthy snacks that you can reach out to. Always keep some nuts and dates, dry fruits available for you so that you can snack on them. And the first step of overcoming any kind of depression or SAD in particular is identification. Identifying that you have the symptoms and reaching out to an expert, a psychologist or psychiatrist, for a proper clinical diagnosis. Once the diagnosis is done, they will take care of the required treatment. Alongside, a proper nutritional plan can also be designed, which will take care of your mood swings, um, also your SAD. Yeah, also we tend to reach out to caffeinated drinks like coffees and teas. So in winters, these numbers will increase, right? As caffeine also elevates your mood. So I will not ask you to completely stay away from them, but then minimize to one cup of coffee or tea a day, right? You can reach out to uh, green tea, which is which has very minimal caffeine in it. There are teas available which has zero caffeine. You can go for that, or we also get decaffeinated coffee, so you can use that. Also, drink a lot of soups. If you eat non-veg, you can go for chicken soup or a mutton soup. If you're a vegetarian, you can go for a variety of soups like tomato, cauliflower, mushroom soups. There are variety of vegetable soups that you can drink during winters. Uh, so these are healthy choices of food which will keep you warm and elevate your mood as well. So these are some tips to overcome the seasonal affective disorder or depression. Um, Also, anything that cheers you up, listen to your favorite music, uh, you know, indulge in any activity or sport, any group activity in particular, aerobics, Zumba, a dance class, any sort of activity that will also elevate your mood, and your you know indulging in a group or team activity. And stay warm, a well-lit environment, and good scents, good perfumes can elevate your mood. um, yeah, most importantly, reach out for help, right? Speak to a friend or family member about what you're going through, and make sure you take help of an expert for a diagnosis and a proper treatment. If you have any questions regarding today's session, you can reach out to me. I will be more than happy to help you. Hope the session was informative. Till I see you next time, stay happy, stay healthy. Thank you.